Hello everyone, welcome back. So today we'll be learning about the splinting techniques which we'll be doing on the cast. So over here, as you can see in the cast, there are all the impression copings which are attached to the lab analogs and secured with the help of a guide pin. Okay, and there are various techniques of splinting. Why we do splinting is to basically secure all the impression copings together, and secondly to have a anti-rotational feature. Okay, so as you can see, I have secured the floss on one end, and then I'll be doing a zigzag method to secure it to all the impression copings. Okay, you can fast forward the video if you want a little bit, so that you'll have a after tying all the floss through and through in a crisscross manner. Make sure that the floss is above the gingiva, slightly 2 mm above the gingiva. So the splinting should be done always above, like 2 mm above the gingiva to have a proper axis. Okay, so tie the other end of the floss at the other corner and secure it nicely, after which we'll be securing this floss to each other with the help of either composite or pattern resin. I'll be using pattern resin over here. You can also use composite to secure this. Okay, as you can see in this cast, one side I have already done the molding of the pattern resin. Okay, on one side I'll be teaching you how to do it. There are two methods basically. Okay, so as you can see, the pattern resin should always be 2 to 3 mm above the gingiva to have a better access. Okay, and it is secured on both the sides, as a tooth is present on both the sides, so it is secured on both the sides. Okay, to have a proper adaptability intraorally. So coming back, there are two methods of actually adapting the pattern resin. Okay, normally everyone does it with the help of Dove stage. Okay, monomer and polymer is mixed, and at Dove stage they adapt it over the impression coping. This technique which I am doing is my method, personally speaking. It is not written in any book or anywhere. Okay, I feel that this method is much easier, simpler, and much cleaner. Okay, so drop by drop I adapt the monomer and polymer over the impression copings and the adjacent teeth, and wherever I feel that a little bit excess is happening, I remove it at that time only. Okay, so it is much clean and it is much easy to adapt as well. You can use a carver or a brush or any like instrument to adapt it. Okay, again telling you, this is my technique. I prefer doing it this way. If you are comfortable with Dove stage, you can do it like that as well. So once it is secured to the impression copings, you can go and extend if it is a class 3 kind of case or any like that. So you can adapt it over the teeth as well to have a proper path of positioning for the impression coping. Okay, so basically splinting is done, okay, to have the exact position of the intraoral, like exact position of the implant replicated on the cast, and to verify it. Okay, for verification we do this jig trial, and jig trial can be done in two ways, either splinting it or non-splinting. Splinting is done in multiple implant cases. Okay, it is not needed for a single implant. Okay, so you can fast forward this if you want a little bit to have a better look. And after this, after adapting the pattern resin, you have to polish it thoroughly and then do the jig trial intraorally, so that you can verify the position of the implant to the cast. Once it is done, then we can further go ahead with the fabrication processes. Okay, so verification of the jig is the important step in an implant procedure. Let me know if you want any specific method or any specific lab procedure which you want to see how the technique is, what are the types of technique specifically in implants or in FMR, so I can put those videos. Okay, I'll be coming up with more 1 or 2 videos regarding the lab work procedures for implant processes. Okay, thank you.